Hello students, this is Dr. Manjunath working as an assistant professor in sociology in SMJFDC Kabahalli, which is located in Chamarajanagar district. And in this video today I am going to discuss about socio-cultural determinants of health. So there are many socio-cultural determinants of health. Here in this video I am going to discuss and concentrate only on two aspects, housing and sanitation. How housing and sanitations are impacting on one individuals or people's health. ಇಂದಿನ ಈ ಒಂದು ವಿಡಿಯೋದಲ್ಲಿ ನಾನು ಈ ಒಂದು ವಸತಿ ಮತ್ತು ನೈರ್ಮಲ್ಯತೆ ಅನ್ನುವಂಥದ್ದು ಹೇಗೆ ಒಬ್ಬ ವ್ಯಕ್ತಿಯ ಆರೋಗ್ಯದ ಮೇಲೆ ಪ್ರಮುಖವಾದಂತಹ ಪರಿಣಾಮವನ್ನು ಬೀಳುತ್ತೆ ಅನ್ನುವಂಥದ್ದನ್ನು ಈ ಒಂದು ವಿಡಿಯೋದಲ್ಲಿ ನಾನು ಚರ್ಚೆ ಮಾಡೋದಕ್ಕೆ ಇಷ್ಟಪಡ್ತೀನಿ. This video will be useful to the 5th semester BA Sociology course, particularly optional subject of medical sociology course of University of Mysore. This video also will be useful to other university students who have the same syllabus, and this is with reference to you can see that second chapter, and the name of the second chapter is Constructing Illness and Health. So I told you this is session's topic is socio-cultural determinants of health, housing and sanitation. So in this video you can see that in the PPT, in the previous session I had discussed about gender as a socio-cultural determinant of health. In the previous session you have learned that how gender is influencing on one's health, and how you can see that the women will be more prone to getting a very disadvantageous services, particularly with reference to health. Only women who are at the time of delivery they get medical attention, and remaining times they will be having a very high tough time, you can see that. So this you must have learned it, and so we have a learning objective. In this you can see that the students will become familiarized with the effects of improper housing and sanitation on health. How when there is a lack of proper housing, and how that lack of sanitation will be having an impact on health. And we have a session outcome also. The students will be able to classify the health problems associated with the improper housing and sanitation. So these are this, and you can see that in this presentation I am going to discuss about primarily these contents. So here I am going to discuss individually housing as a determinant of health, and sanitation as a determinant of health. So these two aspects are very important. You can see that these poor housing conditions are associated with a wide range of health conditions. You can see that, including respiratory infections, you can see, and asthma, lead poisoning, injuries, mental health and other problems they face. Even in India, due to density of population is high, and as well as the population is quite high. India is a second largest country in population terms, but region wise or land wise it is not so. So hence we can see there is a demographic this profile which is a very congested population living all together simultaneously. So this leads to some kind of problems. So particularly slums are there, even in even Mumbai in Maharashtra, the Dharavi slum is, which is the largest in Asia, we can see. So this kind of poor housing conditions lead to many diseases and all. So this is very important in order to understand how this will be having a negative impact on health. So addressing housing issues offers public health practitioners an opportunity to address important social determinant of health. So public health has been involved in housing issues since long, and in the 19th century you can see that these health officials targeted, so they used to concentrate on poor sanitation, crowding and inadequate ventilation to reduce infectious diseases such as even in coronavirus. Now we can see that so in slums coronavirus spreads very easily due to crowding and poor sanitation and inadequate ventilation, so there were many fire hazards also, so there were some diseases also, so these were concentrated by the government officials since the 19th century. Today you can see that public health departments can employ these multiple strategies to improve housing, such as developing some kind of guidelines and codes by implementing healthy homes program to improve indoor environment quality and assessing housing conditions. And so people should get affordable housing and all. So it is the time for the government to create a healthier homes by confronting standard housing. So this is the introduction. So in this part you have learned that housing and sanitation have some kind of impact on the people's health. So separately you can see that ಇತ್ತೀಚಿನ ದಿನಗಳಲ್ಲಿ ನೀವು ನೋಡಿರುವಂತಹ ಜನಸಂಖ್ಯೆ ಒಂದು ಸ್ಫೋಟದಿಂದಾಗಿ ಅಥವಾ ಜನಸಂಖ್ಯಾ ಹೆಚ್ಚಳದಿಂದಾಗಿ ಜನಸಂಖ್ಯೆ ಒಂದು ಒತ್ತಡದಿಂದಾಗಿ ಜನರು ಒಂದೆಡೆ ವಾಸ ಮಾಡುವಂತಹ ಪರಿಸ್ಥಿತಿ ಉದ್ಭವವಾಗಿದೆ. ಕೈಗಾರಿಕೀಕರಣ, ನಗರೀಕರಣಗಳ ಬೆಳವಣಿಗೆಯಿಂದಾಗಿ ನಾವು ನೋಡ್ಬೋದು ಈ ನಗರಗಳಲ್ಲಿ ಸ್ಲಮ್ಗಳ ಬೆಳವಣಿಗೆ ಅತಿ ಹೆಚ್ಚಾಗ್ತಾ ಇದೆ. ಸೊ ಇಂತಹ ಒಂದು ಪ್ರದೇಶಗಳಲ್ಲಿ ಜನರು ಅತಿ ಬೇಗ ಅನಾರೋಗ್ಯಕ್ಕೆ ತುತ್ತಾಗ್ತಿದ್ದಾರೆ ಅನ್ನುವಂಥದ್ದು ನಾವು ಗಮನಿಸಬೇಕು. ಸೊ ಇದನ್ನು ನಿಯಂತ್ರಿಸಬೇಕು ಅಂತ ಹೇಳಿದ್ರೆ ಸರ್ಕಾರಗಳು ಅನೇಕ ರೀತಿಯಾದಂತಹ ಒಂದು ಕ್ರಮಗಳನ್ನು, ಒಂದು ಶಿಸ್ತಿನ ಒಂದು ಕ್ರಮಗಳನ್ನು ಕೈಗೊಂಡು ಎಲ್ಲರಿಗೂ ಅಫೋರ್ಡಬಲ್ ಹೌಸಿಂಗನ್ನು ಕೊಡಬೇಕು. ಸೊ ಆಗ ಮಾತ್ರ ನಮ್ಮ ಒಂದು ಈ ಹೌಸಿಂಗಿನ ಪ್ರಾಬ್ಲಮ್ಮು ತೀರುತ್ತೆ ಅನ್ನುವಂಥದ್ದನ್ನು ಇದರಲ್ಲಿ ಗಮನಿಸ್ಬೋದು. ಹಾಗೆ ಯು ಕ್ಯಾನ್ ಸಿ ದ್ಯಾಟ್ ಹೌಸಿಂಗ್ ಆಸ್ ಎ ಡಿಟರ್ಮಿನೆಂಟ್ ಆಫ್ ಹೆಲ್ತ್. ಸೊ ಡಿಟರ್ಮೈನಿಂಗ್ ಮೀನ್ಸ್ ಇನ್ಫ್ಲೂಯೆನ್ಸಿಂಗ್ ಆರ್ ಹ್ಯಾವಿಂಗ್ ಎನ್ ಇಂಪ್ಯಾಕ್ಟ್. ಸೊ ಯು ಕ್ಯಾನ್ ಸಿ ದ್ಯಾಟ್ an increasing body of evidence is associated with housing quality and with morbidity from infectious diseases, chronic illness, injuries, and poor nutrition and mental disorders. So these kind of diseases are being found because there are no proper housing. Primarily you can see infectious diseases. ಈ ಸಾಂಕ್ರಾಮಿಕ ರೋಗಗಳು ಅನ್ನುವಂಥದ್ದು ಸರಿಯಾದಂತಹ ವಸತಿಯ ಸೌಕರ್ಯ ಇಲ್ಲದೆ ಇರುವಂತಹ ಪರಿಸರದಲ್ಲಿ ಕಂಡುಬರುವಂಥದ್ದು. ಸೊ ಹಾಗಾಗಿ ಲೆಟ್ ಮೀ ಗೋ ಇನ್ ಡೀಟೇಲ್ ಅಬೌಟ್ ಇನ್ಫೆಕ್ಷಿಯಸ್ ಡಿಸೀಸ್. ಸೊ ಬಿಕಾಸ್ ಆಫ್ substandard housing and including there will be lack of safe water drinking, and no water facilities will be there, and so no hot water or washing, and there will be no waste disposal also. So in these kind of places inadequate food storage also will not be proper, and these characteristics or features of not proper housing lead to very spread of infectious diseases. ಸಾಂಕ್ರಾಮಿಕ ರೋಗಗಳು ಹರಡೋದಕ್ಕೆ ಇದೊಂದು ಪ್ರಮುಖವಾದಂತಹ ತಾಣ ಆಗಿರುತ್ತೆ. And crowding is also associated with this transmission of TB and respiratory infections, and even now corona also. And lack of housing and overcrowding are found in temporary housing. Many people who are living in homeless shelters and in slums and all, so they lead to morbidity and respiratory infections. So this is the major disease due to the housing problem. And you can see chronic diseases also. So in the recent years, epidemiological studies have linked substandard housing with an increasing risk of chronic illnesses. So there will be a damp, cold, and moldy housing is associated with asthma and other chronic respiratory systems. So even after potentially confounding factors such as income, social class, and crowding and other things, so there you can see more number of these chronic diseases which are there. And the water intrusion is also a major problem with reference to this housing also. and overcrowding and inadequate ventilations also increase the interior moisture. So this is very important, where inside the house it will always be cold due to not having a proper ventilation. And so these are all very important aspects with reference to chronic diseases, and old dirty carpenting are done. And so these substandard housing so is having some effect on the health problems, and even pests also you can see are being found in the substandard houses. And third one is about injuries, you know so there will be some injuries when there are some kind of substandard houses which are being found. So this is also very important. The importance of designing homes to prevent injuries have received long standing attention, particularly with regard to reducing burns and falls. These are accidents which are happening in the houses and all. So these attributes of substandard housing that increases the risk of just getting into some kind of heating sources, and unprotected upper story windows, low still heights, and slippery surfaces, and breakable window. And these kind of poorly designed houses are also having impact on the health. Inadequate lighting also will not be there. So because of these things, so there will be some injuries with the people. So there should be a proper building design and material influence, so in these kind of things. Childhood development and nutrition. So there is an impact of improper housing on the childhood development at the level of childhood. So when people do not get proper nutrition, so they will always will be prone to chronic diseases, where their immunity system will be very less compared to the children who receive high nutritional values. And so this is also very important regarding housing. And fifth one is about mental health. WHO says that health is not just merely absence of disease, so it also includes physical, mental, so social health. So we have to consider mental health is also a part of health. And so housing has an impact on mental health. ಈ ಒಂದು WHO ಹೇಳೋ ಪ್ರಕಾರ ಈ ಆರೋಗ್ಯ ಅನ್ನುವಂಥದ್ದು ಕೇವಲ ಯಾವುದೋ ಒಂದು ಕಾಯಿಲೆ ಇಲ್ಲದಿರುವಂತಹ ಒಂದು ಪರಿಸ್ಥಿತಿ ಮಾತ್ರ ಅಲ್ಲ, ಅದರ ಜೊತೆಗೆ ಈ ಸಾಮಾಜಿಕ, ದೈಹಿಕ ಮತ್ತು ಮಾನಸಿಕ ಕಾಯಿಲೆಗಳು ಅನ್ನೋದಕ್ಕಿಂತ ಸುಸ್ಥಿತಿಯನ್ನು ನಾವು ಇಲ್ಲಿ ನೋಡ್ಬೋದು. ಇವುಗಳ ಸುಸ್ಥಿತಿ ಇದ್ದಾಗ ಮಾತ್ರ ಒಬ್ಬ ವ್ಯಕ್ತಿ ಆರೋಗ್ಯವಂತನಾಗಿದ್ದಾನೆ ಅನ್ನುವಂಥದ್ದನ್ನು ನಾವು ಇಲ್ಲಿ ಕಾಣ್ತೀವಿ. ಸೊ ಹಾಗಾಗಿ ಈ ಒಂದು mental health. So let me go in detail about mental health. So this substandard housing affects mental health, so this is important. But you can see that excessive indoor temperature, so when temperature is too high or too cold inside the house, and has been linked with irritability and social intolerance, damp, coldy and cold indoor conditions, so maybe associated with anxiety and depression. So when people always will be inside the house, and they think that they will be facing certain kind of medical, particularly with reference to mental illness. And even crowding also associated with psychological distress among women and men. So in some many countries, even in ಭಾರತೀಯ ಒಂದು ಸಮಾಜದಲ್ಲಿ ನೀವು ನೋಡಿದ್ರೆ ಹೆಚ್ಚಿನ ಒಂದು ಗ್ರಾಮಗಳಲ್ಲಿರುವಂಥ ಹೆಚ್ಚಿನ ಜನರು ಅವಿಭಕ್ತ ಕುಟುಂಬದಲ್ಲಿ ವಾಸ ಮಾಡ್ತಿರ್ತಾರೆ. ಸೊ ಅವಿಭಕ್ತ ಕುಟುಂಬದಲ್ಲಿ ಅನೇಕ ಜನ ಇರುವಂಥದ್ದನ್ನು ನಾವು ನೋಡ್ತೀವಿ. 3ಕ್ಕಿಂತ ಹೆಚ್ಚಿನ ತಲೆಮಾರುಗಳ ಜನರನ್ನು ವಾಸಿಸುವ ಒಂದು ಪ್ರದೇಶವನ್ನು ಅಥವಾ ಒಂದು ಕುಟುಂಬವನ್ನು ನಾವು ಅವಿಭಕ್ತ ಕುಟುಂಬ ಅಂತ ಕರಿತೀವಿ. ಅದರಲ್ಲಿ ಸುಮಾರು 10 ಜನಕ್ಕಿಂತ ಹೆಚ್ಚಿನ ಜನರು ಇರ್ತಾರೆ. 10, 20, 50, 100 ಇರುವಂತಹ ಸಾಧ್ಯತೆಗಳಿರ್ತವೆ. ಸೊ ಅಂತಹ ಸಂದರ್ಭಗಳಲ್ಲಿ ಅತಿ ಒಂದು ಜನದಟ್ಟಣೆಯಿಂದಾಗಿ ಆ ಒಂದು ಕುಟುಂಬದಲ್ಲಿ ವಾಸ ಮಾಡುವ ಜನರ ಮಾನಸಿಕ ಒಂದು ಆರೋಗ್ಯ ಹದಗೆಡುವಂತಹ ಒಂದು ಸಂದರ್ಭಗಳು ಕೂಡ ಇರುತ್ತವೆ. ಸೊ ಯು ಕ್ಯಾನ್ ಸಿ ಹೋಮ್ಲೆಸ್ನೆಸ್ ಆ್ಯಂಡ್ ಲಿವಿಂಗ್ ಇನ್ substandard and temporary housing have been related to behavioral problems among children also. So it affects on children also. So this will lead to social isolation because occupants are reluctant to invite guests into their homes because house will not be proper. When house will not be proper, so the residents will not definitely invite guests, and so they will become very isolated and they will not have a social interactions with other people, particularly outside their house. So high rise buildings may innovate social interaction because they lack common spaces. So this will be a major problem, particularly with reference to impact of house improper housing on mental health. So next let me move on to neighborhood effects. So this is also very important, neighborhood effects. You can see that housing unit, there are some kind of neighborhood level effects on health which are also documented in many studies, journals and all. And so these are related to elevated rates of intentional injury and poor birth outcomes and HIV, uh, tuberculosis, physical inactivity, and mortality rate is increasing, morbidity, because of this neighborhood. Particularly what kind of neighborhood so people are living in, there are some kind of neighborhoods where people will be prone to have a diseases, particularly with reference to there in US there are many studies which are conducted on neighborhood impact on the people's health. Even in India also there will be some good neighborhoods, so where people prone to have a good exercise and cultural and very good practices. But there will be some kind of other problems also, particularly with reference to these neighborhoods. So where they will be, which kind of neighborhoods I'm talking about mainly is about low socio-economic status neighborhoods there will be. So independent of individual level is very important, and that will not be happening. So there are several features of these neighborhoods may contribute to poor health. So this air quality will not be good, so because of their proximity to sources of vehicles exhaust, smoke and all, so that also will have a negative impact on the people's health. And improper waste management will be there, so that also will negatively affect on the people's health. So these are the major things which will be having impact on the people's health. So next we will move on to sanitation, as this one how it is impact. Sanitation, you can see that it is also just like housing has impact on health, and it determines how people are going to be healthy or sick. ಈ ಸ್ವಚ್ಛತೆ ಅಥವಾ ನೈರ್ಮಲ್ಯತೆ ಅನ್ನುವಂಥದ್ದು ಕೂಡ ವಸತಿಯ ರೀತಿಯಲ್ಲೇ ಈ ಒಂದು ವ್ಯಕ್ತಿಗಳ ಹೆಲ್ತ್ ಆರೋಗ್ಯದ ಮೇಲೆ ಪರಿಣಾಮವನ್ನು ಬೀರುತ್ತೆ. ಸೊ adequate sanitization, so with good hygiene and safe water are very fundamental to, you can see, good health. So this is very important, how the sanitation is very important. You can see that there are many statistics which I have given here in this presentation. You can go through it. And lack of sanitation, what it will lead, it will happen, so it leads to disease definitely. So even in the corona pandemic time, we can see the impact of this lack of sanitation, how. So in all the advertisements and the television, so there will be many advertisements, and even through cell phones and other print media, where washing of hands is mandatory to fight against coronavirus. So we can see that importance of sanitation. And in very long back, actually, particularly in Great Britain, So there was a study in 1842 on how this sanitary conditions are impacting on people. So it was scientifically conducted, and so it was also provided that it is having a very great impact on healthy conditions particularly. And poor sanitation will definitely lead to so diseases and all. So these diseases which are associated with poor sanitation are particularly correlated further with poverty and infancy and these kind of things. And 10% of global diseases are directly related to lack of sanitation. So this human excreta and these are most dangerous on health, and which is being found if there is no proper sanitation. And due to improper sanitation, we can see a lot of health problems in this you can see diarrheal diseases are being found, are the most important of oral diseases globally, causing 1.6 to 2.5 million deaths annually, many of them among children under 5-year old because of lack of sanitation. So, particularly in Africa and sub-Saharan Africa and all, there were 19% of these deaths are being found. So this is very important that diarrheal diseases are very major problem because of this. So there are many studies, reviews are conducted, and how water and sanitation and hygiene interventions are having a positive impact. Particularly in Brazil, it was a study conducted where they had reduced the diarrheal effects because of just controlling sanitation. This is very important. And second problem is neglected, trophical diseases. So these neglected, trophical diseases while resulting in little mortality and cause substantial disability adjusted life. So, in many countries, particularly many of these diseases have a facio-oral transmission pathways. That's improved, sanitation. When sanitation is improved, definitely, so we can reduce these kind of problems. So this is very important. And so there are many other problems of not maintaining sanitation, particularly acute respiratory infections and all. So here you can see 4.2 million deaths each year are happening because of acute respiratory infections, particularly in developing countries, due to not maintaining sanitation. So sanitation is very important in particularly in rural areas where these kind of diseases are being found, and hence sanitation could be a powerful intervention against acute respiratory infections. So if we and in these villages and all, if people become aware about this kind of diseases and all, how it spreads, so it is easily just avoidable, and we can reduce it. So undernutrition is also very important, particularly in many, particularly in Karnataka state, we can see that many of the children who are living in North Karnataka, level of nutrition is too low. So this poor sanitation, hygiene and water are responsible for these things and all. And maternal underweight and primarily through so these diseases and under nutrition and all, so whereby exposing to one increases vulnerability to other. So this is very important, where nutrition is about being found under nutrition particularly. So this is primarily how it is impacting on this. In conclusion, we can see that so in summary, we can see that substandard housing affects multiple dimensions of health. This is very important. There is an evidence that poor housing conditions, contribute to increasing exposure to biological, chemical, and physical hazards also, which affect psychological, biological, processes. So these are all very important. And sanitation is also a very important thing. Sanitation is a complex topic with links to health and social and economic development. It affects many, but is very few people who have conducted a detailed study from that. So we have to see that there are many strategies to understand these kind of problems. Government agencies have a important significant role in providing infrastructure where housing and sanitation problems can be solved, and the health sector is very important in improving these sanitation facilities given to the people, and we have to bring some kind of awareness among the people, particularly in rural India, in order to improve their housing as well as sanitation. ಇಂದಿನ ಈ ಒಂದು ವಿಡಿಯೋದಲ್ಲಿ ನೀವು ಹೇಗೆ ಈ ಒಂದು ವಸತಿ ಮತ್ತು ಈ ಒಂದು ನೈರ್ಮಲ್ಯತೆ ಅನ್ನುವಂಥದ್ದು ಒಬ್ಬ ವ್ಯಕ್ತಿಯ ಅಥವಾ ವ್ಯಕ್ತಿಗಳ ಅಥವಾ ಜನರ ಆರೋಗ್ಯದ ಮೇಲೆ ಯಾವ ರೀತಿಯಾದಂತಹ ಪರಿಣಾಮವನ್ನು ಬೀರುತ್ತೆ, ಸೊ ಹೇಗೆ ಆ ವ್ಯಕ್ತಿಗಳು ಈ ಒಂದು ಆರೋಗ್ಯವನ್ನು ಕಾಪಾಡ್ಕೋಬೇಕು ಅಂತ ಹೇಳಿದ್ರೆ ನೈರ್ಮಲ್ಯತೆಯನ್ನು ಯಾವ ರೀತಿ ಕಾಪಾಡ್ಕೋಬೇಕು, ಮತ್ತು ಉತ್ತಮವಾದಂತಹ ವಸತಿ ಸೌಕರ್ಯವನ್ನು ಹೊಂದಬೇಕು. ಸೊ ಆಗ ಮಾತ್ರ ಅದು ಪಾಸಿಟಿವ್ ಆಗಿ ಇಂಪ್ಯಾಕ್ಟ್ ಮಾಡುತ್ತೆ ಹೊರತು ನೆಗೆಟಿವ್ ಆಗಿ ಅಲ್ಲ. ಸೊ ನೆಗೆಟಿವ್ ಆಗಿ ಯಾವಾಗ ಇಂಪ್ಯಾಕ್ಟ್ ಮಾಡುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ ಈ ಒಂದು ರೀತಿಯಾದಂತಹ ಇಂಪ್ರಾಪರ್ ಹೌಸಿಂಗ್ ಇದ್ದಾಗ ಮತ್ತು ಸರಿಯಾದಂತಹ ವಸತಿ ಮತ್ತು ಸರಿಯಾದಂತಹ ನೈರ್ಮಲ್ಯತೆ ಇಲ್ಲದಿದ್ದಾಗ ನಾವು ಇಂತಹ ಒಂದು ಕಾಯಿಲೆಗಳನ್ನು ನೋಡಬಹುದಾಗಿರುತ್ತೆ. ಸೊ ಇಲ್ಲಿ ರೆಫರೆನ್ಸಸ್ ಕೂಡ ನಾವು ನೀಡಿದ್ದೀವಿ. ನೀವು ದ ಸೋಷಿಯಾಲಜಿ ಆಫ್ ಹೆಲ್ತ್ ಆ್ಯಂಡ್ ಇಲ್ನೆಸ್, ಸರಾ ನೆಟಲ್ಟನ್, ಇವರ ಒಂದು ಪುಸ್ತಕವನ್ನು ಕೂಡ ನೀವು ರೆಫರ್ ಮಾಡಬಹುದು. ಅದೇ ಥರ ದ ನ್ಯೂ ಬ್ಲ್ಯಾಕ್ವೆಲ್ ಕಂಪ್ಯಾನಿಯನ್ ಟು ಮೆಡಿಕಲ್ ಸೋಷಿಯಾಲಜಿ, ವಿಲಿಯಮ್ ಸಿ ಕುಕ್ರಹ್ಯಾಮ್, ದಟ್ ಈಸ್ ಆಲ್ಸೋ ಒನ್ ಆಫ್ ದಿ ಬೆಸ್ಟ್ ಬುಕ್ ಆನ್ ಮೆಡಿಕಲ್ ಸೋಷಿಯಾಲಜಿ, particularly to understand housing and sanitation. So thank you for watching.